morning. My name is Ben Bingle, and I'm the director of the DeKalb County Nonprofit Partnership. I want to thank you all for joining us today. We have a few housekeeping items before we get started. We'll be recording today's webinar, and the recording will be sent to you later by email, along with an evaluation form for you to provide feedback about today's session. Please feel free to share this recording with others in your organization who may not be attending right now. We have everyone muted, but please feel free to use the Q&A and the chat feature at the bottom of your screen. We'll be saving some time at the end of today's presentation to address questions that you submit. We'll plan to have about 45 minutes or so of content and then around 10 or 15 minutes for Q&A. We plan to wrap up in about an hour's time. So with that, we just want to say how excited we are to welcome back Paul LaLonde for part 2 of this mini-series on human resources. Many of you know Paul from his time working at VAC, and he also served on the DCMP steering committee, but here's a little bit more about his background. Paul LaLonde is an enthusiastic human resources professional with over 10 years of experience. He currently serves as the HR director for the Community and Economic Development Association of Cook County in Chicago, which is the largest community action agency in Illinois. Paul's an avid reader and writer. He has a blog titled The HR Philosopher, and he also writes for the Society of Human Resource Management blog. Paul is presented on to local SHRM chapters and presented at conferences on a variety of different HR topics. And in addition, he does consulting for nonprofit organizations through his business, HR Logic. And I love this part of his bio. Paul is a St. Louis Cardinals fan, a self-professed Game of Thrones geek, and a heavy metal enthusiast. He's also a proud husband, father, and owner of a disobedient cat. Welcome to Paul. Thank you so much for joining us.
Awesome. Thanks, Ben. I appreciate you having me back and bringing me here. So, welcome back, everybody. I hope you were able to join me for the first one. And the first one was more about the nuts and bolts of how human resources has changed for the pandemic. This second one is more about how do you work with your staff now. So I'm going to be pretty quote heavy today because I think that they help us quite a bit. So with that, I want us all to think about this quote because I think it kind of permeates throughout the entire presentation today. Thich Nhat Hanh is a Buddhist monk from Vietnam, and he was very active during the Vietnam War. He said people have a hard time letting go of their suffering because out of a fear of the unknown, they prefer suffering that is familiar. And I think it's human nature to avoid what makes us uncomfortable. So today we're going to talk a lot about uncomfortable topics and what we can do to better ourselves. So another quote is from Mark Perry, who worked very closely with the DCMP on several times. He said a quote a couple of times that really stuck with me, and that is, there is no movement without friction. Friction is hard, right? It creates heat, and heat is uncomfortable. But without friction, nothing moves. We stay stagnant. So to get out of our comfort zones, I'm going to be referring to this several times today. So think about your comfort zone, what's safe and in your control, and you feel like you're in control, even if you're not, keeps us from going into the fear zone because we're intimidated by outside ideas. We're not as confident. We have excuses. But if we continue to push through that and create our own friction, we can move into the learning zone, acquire new skills, become better problem solvers, and be receptive to outside input. And eventually we grow and we expand and become better. And that's the whole point. So topics today, we're going to talk about the mental health crisis. And there was a mental health crisis prior to COVID-19. And COVID-19 has just exacerbated it. We're going to talk a little bit about how the mental health crisis links to COVID fatigue and how you can help motivate your employees and your volunteer staff through that. And then finally, how is the mental health crisis connected to the social injustices and social disruptions that we've been seeing over the past several months, and really for most of this country's history, but now it's just come to the forefront in ways that we haven't seen in a generation. Before I get too far into it, I always have to do the legal disclaimer. This one doesn't have as much legalese as it, but remember, if you're making any decisions, et cetera, always talk to your legal counsel just to make sure it's on the up and up for you and your organization. So before we begin, I'm going to ask Ben to throw up a poll. And this poll is going to pretty much ask all the participants, does your organization have an EAP? Yes, no, or what's an EAP? So I'll give everybody a little bit of time to answer that, and I'll get back to that in a minute. Got some results coming in. Wow, quite a bit of what's an EAP. That's a good opportunity, so I'm glad that I dedicated some time to talk about that. Yep. Okay, looks like most everybody's voted. So we have about 33% of audience does have an EAP. 14% do not, and then wow, over half say what's an EAP. So I am excited that I get to share what an EAP is with all of you, and we can talk a little bit more about it. All right, so mental health in the age of COVID. I'm going to share some stats with everybody. Again, there was a mental health crisis in the United States prior to COVID-19, and these numbers come out prior to COVID. So approximately 1 in 5 adults in the US, or about almost 19%, has a mental health illness in a given year. Approximately 1 in 25 US adults, almost 10 million, experience a serious mental illness in a given year that interferes with their or limits one or more major life activities. Approximately 1 in 5 youth in the teenage years, so 21% of our teenagers experience severe mental disorder at some point in their life during that time frame. And for children age 8 to 15, it's 13%. And that one is pretty scary to me because they're so young at that age, obviously. About 7% of adults in the US, so 16 million, had at least one major depressive episode in the past year. About 18.1% of adults in the US experience an anxiety disorder, PTSD, obsessive compulsive, and other such phobias. And about 20 million adults in the US experience a substance use disorder. So and about half of those individuals had a co-occurring mental illness in the use of substance abuse. So while 43% of adults with mental health, only about 43% of adults with a mental health or a disorder seek treatment. So less than half don't even acknowledge it or seek help. The average person, when they do decide to seek help, waits between 8 to 10 years. So not only are they not getting help, they're waiting 8 to 10 years. Think of mental health in the same aspect as a serious physical ailment. If you broke your arm, would you wait 8 to 10 years to go get help to get your arm fixed? No. So a lot of people don't seek help right away. And 80% of those folks who say that talk about the stigma that prevents them from going to seek help. So what happens when people don't go and seek help? There's major consequences for that. So serious health, mental health costs America about $200 billion in lost earnings per year. So mood disorders, depression, other bipolar disorder are about third most common cause of hospitalization in the US. So all those hospital beds and nurses, instead of helping COVID patients, they have to help mental health patients. So individuals living with serious mental illnesses face an increased risk of having chronic medical conditions. So a lot of times it's not just depression. Depression comes with a whole host of other physical attributions as well. So it's not just in the mind, it spreads to the physical aspects of the body as well. Ultimately, suicide is the 10th leading cause of death in the US and the second leading cause of death between ages 10 to 34. And again, that's a pretty disconcerting number. Between ages of 10 and 34. That's so young that people feel that they have to go that route just to deal with what they have to deal with. And then more than 90% of people who die by suicide show symptoms of mental health. So they go hand in hand. And then finally, estimated 18 to 22 veterans die by suicide every day. I just wanted to show some more numbers. In the interest of time, I'll just kind of quickly go through some of these things. Again, I know Ben has made or will make the presentation available to everybody, so you can take a closer look at these numbers if you need to. So again, I just put these up here just so you guys can kind of see some of this stuff. A lot of this has, stress related to coronavirus, has a negative impact on their mental health. So we had the mental health crisis prior to Corona. Corona has only exacerbated it. And this poll by the KFF Foundation helps kind of showcase since early March where people were and how in July it's reaching peak levels. So almost half of people, older adults especially, are saying that coronavirus is affecting them in negative ways. So as it comes to work, I think about how many of you, and you can add this into the chat section to let you know, how many of you heard this the following, or you've said this, I'm exhausted, overwhelmed, just anxious, fearful, I'm just tired, I'm fatigued, frustrated, I don't know what's going on right now. My workload is just not sustainable. There's just too much going on. All of this is connected. I think for right or wrong, as managers and leaders in the nonprofit space and just any space, we hear, oh, our employees complain about X, Y, Z all the time. So we tend to brush it off. But given under the microscope of COVID, I think we need to take a closer look at a lot of those employees' complaints. So COVID fatigue is real. It's a type of what is called a caution fatigue. And that's essentially the body and mind tire from having a sense of danger. When, from the human evolution aspect, anxiety and fear are good because they keep you alive. When you are a caveman in the cave and you hear rustling of bushes behind you, you freak out and you run away because you don't know if that's a saber-toothed tiger about to get you and your family. We don't have that anymore in modern society, right? We don't feel that the saber-toothed tiger is just going to jump out of the bushes to get us. But humans haven't evolved that far away yet. So even though there may have been real anxiety was a defense mechanism to help keep you alive, today we don't have that same sense of heightened need. So and the mind starts grasping onto all these other anxieties that keep the body alive in its own mind. So when the body is continually in that state of caution and anxiety, it just leads to destruction inside mental capacities and physical capacities long term. So overall, we get tired of just being cooped up, tired of being careful, tired of being scared. You just get tired of it all and you're like, oh, I'm not going to wear my mask this time, or I'm just going to go out to a party just once. I'll keep my distance. We'll see what happens. And it doesn't usually lead to good effects. So COVID fatigue, some of the effects of it, and you can kind of see this in your volunteers or your staff. A lot of symptoms of depression could pop up. That means looks like being withdrawn, not as excited, or changes in personality. You notice people have difficulty concentrating. They're not paying as close of attention as they used to. or their work starts to slip, or the volunteers don't come in as much as they used to. You start understanding, feelings of failure, letting people down, letting the team down. You hear those kind of comments. Comments of hopelessness. Just, I don't know when this is going to end. I don't get it. This isn't going to end, kind of a thing. People used to have interest in certain activities, and they stopped pursuing those activities. So if you had those volunteers that always showed up every Tuesday to do XYZ for your organization, they stopped showing up. It's probably good to just do a wellness check, see where they're at, what's going on. Always feeling tired, and this isn't, the baby kept me up all night crying tired, and that's been on top of my mind because we just had a new baby, but it goes beyond that. Not only feeling tired from mentally exhausted, but physically exhausted and being unable to complete just normal tasks that you normally would be able to. Between 22 and 35% of U.S. employees have been experiencing these symptoms over the last couple of months, according to a recent SHRM survey, and that's the Society for Human Resource Management. So you take all this information and you sort of compare it to what is on employees' minds. And this data is from April, but not much has changed between now and then, a whole lot. But these are pretty heavy topics weighing on people's minds. So job security is number one. What's going to happen with my job? Am I being furloughed? Am I going to be being brought back? Are we even being able to keep the doors open? Personal health is a big part, and those two are related, right? If you don't have job security, do you have the insurance to help with your personal health if you get COVID? Childcare and homeschooling is a massive one for most working parents. I don't know any working parents who haven't had that on their mind. Then personal finances, working remotely for a lot of folks who aren't used to that, et cetera. So these are a lot of things that are on people's minds, and they bring it into the workplace, right? Or the volunteer space. To what extent have you felt the following? Most people feel burned out by work. Most people are feeling that they're used up by the end of the workday, and they've been emotionally drained. So I think this is just all same data, just telling the same story in different ways. So just real quick too, something to think about is from a generational aspect. About 29% of Gen Z, which is the oldest, are about age 23, said they felt depressed or hopeless. 22% of millennials between the ages of 23 and mid 40s or late 30s have felt hopeless or depressed. And then it kind of goes down a little bit. Gen X is about 16%, and baby boomers are about 16% too. So it seems that the younger generations are feeling it to a big extent. So what do you do to cope with a lot of this stuff? Well, number one is take care of yourself. Exercise, eat well, sleep. And you might say, every article I read or everything I see, they always say that. They say that because it works. It's probably one of the hardest things to do. For me personally, I hate exercising. I just do, but you just make yourself do it because at the end of the day, you really do feel much better about it. Eating well, skip the chips, go for the broccoli, and then of course sleep. And they're all tied together. If you exercise well, you eat well, you sleep better. Over time, you'll start seeing it have results. I think talking about it, staying connected with your loved ones. Remember, I always like to say you're in quarantine. I always preferred that word, quarantine versus isolation, because isolation to me has a very negative connotation. Where quarantine, if you're quarantined, you can still be connected to folks, right? You just can't go physically connect to them, but you can call them, you can text them, you can go on Zoom chats with them. When you're in isolation, it has sort of this mental negativity that you're by yourself. You have no one to connect to. So reach out and just stay connected with people. That's the biggest thing, you know. It goes all the way back to Aristotle saying that humans are social creatures. I think having constructive thinking, and that doesn't say positive thinking on purpose, because I think there's this new kind of trendy, buzzy, whatever you want to say, thought going around called toxic positivity. And with toxic positivity, it's almost being in denial. It's saying nothing is bad, everything is good. And that just isn't the case, because to that individual, something is bad. Now, it doesn't mean that bad can't be turned into good, but denying that it is bad just has some major implications to a lot of folks. So constructive thinking, you know, avoid random internet searches, avoiding constant news exposure, staying connected to trusted sources of news. It's being intentional in how you're consuming a lot of these things and how you're thinking about a lot of these things. It's knowing that, yeah, this pandemic is awful. It's bad news, but there's a lot of good that can still come out of it if we look for it and find our way through it and find our way through the bad. Mindfulness and gratitude. Mindfulness has been a buzzword for the last decade, but it works. There's a reason that an entire religion is founded on the concept of mindfulness in Buddhism. And Thich Nhat Hanh, who's a Buddhist monk, who I said he's considered, or unofficially considered, quote unquote, the happiest man in the world. I think Oprah called him for a reason. But he spent his entire life, 90 plus years, mastering this concept of mindfulness. It's not just an Eastern concept either. The West has a very long tradition with mindfulness. And studies have shown mindfulness is just living in the present right now. It's noticing that the future hasn't happened, and the past, there's nothing you can do about it. The only thing that truly exists is the here and the now. So focusing on that and connecting it to what you're grateful for. Studies show that doing that raises people's how they feel about themselves and in the world, and their overall health is increased by that. Even if it's something as small as I'm just grateful that I talked to somebody today. I'm grateful that I ate this apple. It's even those little things. It doesn't need to be these giant platitudes. Just something small that you can latch onto to be grateful for today. You know, I went down one belt loop size. You know, that COVID-19. I've been able to exercise and beat the COVID-19 weight gain. So what can employers do? You're a nonprofit employer. A lot of these things that I talked about in this slide, you can't necessarily, you know, you can't make employees do a lot of these things, right? But there are other things that you can kind of do to help foster your employees and your volunteers. So try to create a culture that supports mental health. And I'll get into a little bit more about that, you know. Taking time off, having a mental health day is the same thing as taking a personal day. Use a vacation day. Let someone go if you notice somebody is just not with it right now, you know. If it's affordable and you can do it, you know, just to send them home early and pay them the rest of the day. You know, it's just something small like that that can kind of help them focus on their health a little bit. Increase the awareness, so give employees access to education and resources. You know, share this PowerPoint with them is a big thing. Share it with your volunteers. Offer trainings to managers if you can. Especially, I'm a big proponent of mental health first aid. And mental health first aid offers education and training to spot warning signs and symptoms and how to approach them with mental health signs and symptoms. You know, whether it's a work-life balance, work-life integration, work-life blend, whatever you want to call the term, you know, let them know that that their life doesn't begin and end at work or at their volunteering. They have an entire life outside of this, and they do affect one another. You know, life doesn't end. Your home life doesn't end the minute you walk into the office, and vice versa. So letting people know that you support them through a lot of those challenges. Develop some mental health policies to help prevent bullying and other places that help further the stigma. So let your employees know that you are a mental health positive culture. You know, just something simple. Treat people fairly and empathetically. Screening resources if you can, medical insurance to help cover a lot of those things, again, if you can. I know that isn't always the case for all employers of nonprofits especially. Monitor your employees' engagement, just kind of keeping up with them. Then finally, the EAP. So let me get into what is the EAP. It's not a four-letter word. For those that know it, it sort of carries this stigma with it. And EAP stands for Employee Assistance Program. It's essentially, it's a voluntary work-based program. It offers free and confidential assessments, short-term counseling, referrals, resources for your employees who have personal and work-related issues. EAPs help enhance organizational effectiveness. They help identify and remove participants' obstacles, productivity, et cetera, and help people kind of cope with their depression or some of their life's issues. The programs help reduce direct medical costs as well, because it's creating an avenue for mental health resources for employees who otherwise wouldn't have those resources. So here's just kind of a quick, some of the things that EAPs help do. A lot of them now are starting to get text therapy. They can help email a counselor, your employees can. Schedule callbacks and webinars with the counselor, live chat sessions. Work site counseling is a big one, especially if you had a really traumatic experience happen. You can have a counselor come in on site. Now, where would you go to find this is if you have a broker, your broker can help you find a really reputable EAP. And Kishwaukee Health Services in DeKalb had a really good EAP program. These are just some stats that kind of show the coronavirus has changed the way employees access mental health. As you can see, a lot of face-to-face counseling has gone down while video therapy has gone up. And a lot of EAPs have invested in that technology and made resources more available to help those. Now, of course, you're thinking, well, I'm on a budget, I can't really do a lot of this. A lot of EAPs have measurable impact on your budget. So if you look productivity, a lot of EAPs, absenteeism and presenteeism go down after visiting an EAP. You might think, well, what's presenteeism? That's where the employee just shows up. They're just going through the motions. They're not really maybe even super productive. EAP participants have shown decreases in depression, as you can see before the EAP and then after the EAP. And alcohol use has gone down after people have gone to see the EAP. I think the big thing with the EAP is to remember, you know, this quote by Epictetus, who's an ancient Greek-Roman philosopher, but happiness and freedom begin with a clear understanding of one principle. Some things are within your control, some things are not. It's always in everybody's control to seek help when they need to seek help. And in the context of COVID, this was making its rounds, and I ended up posting it on LinkedIn, and it got a lot of traction when I posted it, because I think people were just seeking some sort of reassurances. So remember, if you cannot control it, all the things around there, just disregard it. Don't worry about it. There's nothing you can do. Why worry? You only have so much worry to go around. I would focus it on what I can control, because that's where you can make a difference. With that, I'll go back to our comfort zone, right? So what do I want to be during the COVID-19 pandemic? Think of it in terms, again, of the fear zone, the learning zone, and the growth zone. The only way to get through these zones is to move. And by moving, it creates friction, which creates a lot of anxiety within you. So we start in the fear zone, you go to the learning zone, you ultimately make it through all of this to the growth zone. So again, I think talking it in terms with that, with your volunteers and your staff, I think employers at this time have to put on their counselor's hat to a degree to really help people through this. Again, we're in this together. And the only way that we're in this together is if we move together and take the lead on that. So with that, I'm going to move on to the next poll. So Regis or Ben, the next poll is, do you feel your organization's diversity, meaning a board, staff, volunteer base, is representative of the larger community? Yes, no, somewhat. And do know this is 100% confidential. I have no idea who's voting on what or whatnot. So if you have some reservations, it's not meant to be a negative poll. It's just so got a few more. Looks pretty even across all three. So there you go. So about 29% say yes, my organization is representative of the larger community from a diversity aspect. 33% say no, and about 38% say we got some work to do. I would say that overall that doesn't surprise me, not from DeKalb aspect, but I mean from just a general American aspect. So we do have some work to do. So with the next thing, quote to ponder, there. This quote started making the rounds a couple of months ago, and this is a game changer to me. I'd never heard this quote from Jane Elliott, who's an American educator. And when I first read this, it really, I mean, it just blew my mind, and it pretty much changed the way that I think about a lot of different things. And you know that deep down you think of these things, but then being able to articulate it in a way that she was able to do was, again, very earth-shattering in my mind. So if you as a white person would be happy to receive the same treatment that our Black citizens do in this society, stand. And she's in front of a crowd when she's saying this, and nobody's standing, nobody's moving. She goes, okay, you guys aren't understanding the directions. If you white folks want to be treated the way Blacks are in this society, stand. Nobody's standing. That says very plainly that you know what's happening. You know you don't want it for you. I want to know why you are so willing to accept it or to allow it to happen for others. This quote was actually from the 1980s. You're like, well, this wasn't the other day. No, this was from the 1980s. And actually, she started doing a lot of her work from what I read in the 50s and 60s. So talking about mental health in America, you have to link it to the social injustices and the disruption that's currently happening in society. So when I talk about racism, you know, it refers to discrimination or antagonism directed against a person or people on the basis of their membership of a particular race or ethnic group. We know, or at least we think we know a lot about that, right? Racism is institutionalized. You know, racism is at the lead level, so it's part of the system. People aren't necessarily racist. They can act in racist ways, but we talk about prejudices, and I'm not going to get into that because I'm not the society, but you have to start, in my belief, a lot of people need to start really taking a deep dive into these terms and understanding what it means. So systemic racism occurs when the environment, again, dictates the aspects of the individual's life, and then the outcomes of that. Black individuals are more than 3 times as likely as white people to be killed during a police encounter. Black drivers have been somewhat more likely to be stopped than whites, but have far more likely to be searched and arrested. Although Blacks and Latinos comprise 29% of the US population, they make up 57% of the prison population. Nearly half, so almost 50% of the 200,000 people serving life or virtual life prison sentences are Black. Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women, according to the CDC. That is the outcome of racism. Now you might think, well, that's at the individual level, that's at the societal level, and that's why we have to take a much more nuanced approach to this and head-on approach. Again, the end result is racial inequities. What about the views? Oop. Boy, that got cut off. There you go. All right. So according to a Pew study, and I put the link in there, so when it gets sent out, you could go in and take a look at that. Whites are more likely than Blacks to say too much attention's paid to race. Of course, because you know, the fact that whites aren't affected in the same way, well, they think, yeah, you're making a big deal about race, when it doesn't affect them on a day-to-day level as it does of a Black individual. Whites and Blacks differ widely in the view of how Blacks are treated. Well, of course, most whites who aren't Black, obviously, aren't being exposed to that on a daily basis. You know, I always said the term driving while Black changed the way that I saw a lot of things. I, as a white man, don't have to fear being pulled over due to the color of my skin, whereas many Black individuals repeatedly say that all the quite frequently. Again, seeing racism. Adam Grant is a organizational theorist at Wharton School of Business. He's outstanding. So I always advise that we take a look at what he has to say. Seeing racism as an individual problem allows us to distance ourselves from it, right? I'm not racist. I'm not prejudiced. I don't need to worry about it. But when we shift our view and recognize it's an institutional problem, we have to admit that this institution favors me, and that's not fair. I always liken it to think of it like, well, okay, that happened in the past. I didn't have anything to do with it. Why do I have to fix it? Well, when someone leaves a baby, a newborn baby on your front porch, that's not your baby. You didn't bring it into the world, but now you're responsible for it. So that's the way I kind of liken a lot of this. So what are white people to do? We have to become uncomfortable. You have to become comfortable in being uncomfortable. You just have, that's the only way that we can get through this. So we have to acknowledge American racism and white privilege. And I know these are very divisive terms right now. Again, friction causes heat. And we're very frictitious right now, if that's a word that I just invented. But I just want to point out too, privilege is an unearned advantage or benefit. White privilege doesn't mean that whites have had it easy. It doesn't mean that whites haven't had a hard life, or individual white folks haven't had it difficult. Lots of whites are poor. Lots are hurting for work, and it's incredibly hard. But it doesn't mean, but it means that being white wasn't the cause of it. You know, again, it goes back to the driving while Black thing. You might be a poor white person who's just struggling to live day to day, but you don't have that fear of being pulled over while driving. The other thing is to pledge to be anti-racist, and there's a big difference. It's one thing to say, well, I'm not racist, but it's a different thing to be anti-racist. Not being racist is very passive, whereas being anti-racist is active. It's accepting that there's a lot of work to do and rolling up your sleeves and doing it. John Amachi, who's a psychiatrist and a former NBA player, said there's a big difference between being not racist and being anti-racist. I know it doesn't seem like it. I know both of these things seem equally good, but they're not. You know, again, being not racist, again, is passive. It's sitting back and accepting the world as it is. Being anti-racist is active. It's not accepting the world as it is and working to move forward. Third, discover what it is to be an ally. You know, an ally means you're taking on the struggle as your own. If you're a white individual, it means that you're using your privilege and where you are in society to lessen the burden for others. It's not that you need to save anybody or you know, have this complex of changing the entire world. It's just simply doing these small steps that are actually quite revolutionary when you add them all up. You know, it's confront racism, even when your voice shakes. If you hear a comment, it's not just ignoring it, it's attacking that comment. Check on Black loved ones, family, friends, colleagues, your volunteers. Do diligent research. You're responsible for your own education. No one else is. Resist the temptation to ask your Black friends, well, what do I do? That's not for them to tell you. There's plenty of resources out there. That's on you to step up and to help people. And again, don't make the conversations of race about you. And these are just general ideas that I've seen presented over and over again from a lot of well-respected Black professionals that are putting this out there. So again, being an ally means you're taking on the struggle as your own. Use common sense to figure out how to participate in social justice. Again, I want to make it clear too, this isn't a political statement. To me, social injustices that have been happening to the Black community for 400 years are a human element. It's not politics, it's people. So what are employers again? Again, be uncomfortable, do training. There's a whole bunch of these trainings that have gone up over the past several months. So I would strongly encourage you to consider doing a lot of these. And you know, in the interest of time, I'm going to again kind of go through some of these relatively quickly. Again, so what can employers do? Employers have to become uncomfortable. So again, reach out to your Black employees and volunteers. Provide supplemental support options, encourage employees to use them. One really cool example is have a policy that allows your employees to take time off to go attend protests. That's a really good way, I think, to show that you're supporting them in the cause. Develop formal agency statements on racial injustice and inequality, but don't just create the statement. Come up with action plans on how you as an agency are going to help correct a lot of those injustices. Examine your organization behind the scenes. You know, make sure that if there is racism or even covert prejudice behind the scenes, you stamp it out right away and you address it right away. Look at your hiring plan. Do you have, if you aren't as representative as you would like to in the community, become very aggressive and create an aggressive plan in how you're going to become representative. I always say, you know, consider diversity and inclusion separately, and don't forget equality or equity. So DEI is a big thing these days, but I always say, you know, diversity is being invited to the dance. Inclusion is being asked to dance. There's a big difference. You know, just having numbers, okay, we have a lot of Blacks. Well, that's great, but if they're not being asked to dance or not being actively included, what's the point? You're just having numbers. You're not making tangible changes. So invite them to the dance, and then equity is teaching them to dance or asking them to teach you to dance if need to. So that way we're all kind of doing our own different dances together. Again, I think make investments in worthy partnerships. One of the things I regret most about leaving the DeKalb area is those partnerships at the DCNP. Every not-for-profit, you know, there's not this sort of a culture of competing, whereas you're taking money from me, no. All the not-for-profits work together in various ways and lean on one another. So make partnerships along social justice. in how you're going to combat it together as a not-for-profit community in DeKalb area. And for your reading ability, I've put together a whole list of resources for you. There's a whole bunch of links there on how you can, if you need to, find out more about it. So again, one last thing, we're going to revisit the racial comfort zone. Again, remember, no growth happens, no movement happens without friction. So becoming anti-racist, you start in the fear zone, you move to the learning zone as you get more comfortable with being uncomfortable, to finally the growth zone at the end. And then kind of want to leave you with, again, there is hope. I ended my last presentation with this. There is hope. We have to have it because I've seen it. And the next steps will be positive if we move through this together from the end. So that was just kind of my quick rundown of mental health, how it's affecting America today from the COVID angle and the social justice angle. So that I'll open up to questions.
Thank you, Paul. Some very thought-provoking content today. We appreciate that. Reminder for everybody, if you have questions, go ahead and use the Q&A function at the bottom of your screen. We have had some questions that have come in, so I'll just get started with those, Paul, if that's okay with you.
Of course.
Okay. Our first question asks, what recommendations do you have for creating an EAP at a very small nonprofit organization? We just have part-time staff and volunteers. Are there models or examples that you can share?
I would suggest the first thing to do is reach out to, if this individual is in the DeKalb area, reach out to Kishwaukee College. Or not Kishwaukee College, I apologize. It's not Kish Hospital anymore, but Northwestern. They have a very good EAP program, and they can give you a cafeteria plan essentially. So you just talk with their partner and say, this is who we are, this is what I'm looking to do, this is our size and our budget, what can you help us with? And I know that they're very accommodating and flexible and can figure something out for the staff.
Okay. Next, isolation has played a role in some challenges here. What do you recommend other than Zoom, etc., to help staff feel connected again?
Mm-hmm. No, this one's challenging because I think everybody's an individual and everybody's a little different in their comfort levels, right? You have those that are so comfortable they act like life hasn't changed a whole lot, and then you have others that are just holed up in their house and they think Armageddon is here. The truth is really somewhere in between. If you are comfortable with it, and now's a good time because the weather is starting to not cold, but it's starting to turn, but hold a staff gathering at an outdoor facility. You know, fatties, get the potato salad ready to go, and that way it's outside, it's well ventilated, there's plenty of social distancing that can happen, and that people can get together in person. That's just one example. The other can be, you know, hold an outdoor meeting, do the exact same thing, but just put some picnic tables outside your office, or find a park space that parks are open again. And again, you're outside, you're social distancing. Masks could be optional in that environment if you feel it can. That's just one way of getting people together in a face-to-face environment without making it too uncomfortable for some.
Mm-hmm. Okay, thank you for your response to that. We have another one here that says, I sometimes have a hard time, quote, finding the right words when talking with staff about these issues. I don't want to be insensitive or put my foot in my mouth, but I also want to help. Do you have any thoughts?
Yeah, the first thing is you're gonna mess up. That's okay. And I haven't come across one individual who's like a thought leader in a lot of these spaces who hasn't said the fact that you're trying means so much. And it doesn't matter if you put your foot in your mouth, because you're trying and you're moving and you're learning along the way. Again, it's part of that becoming comfortable with being uncomfortable and knowing that. I always advise to, open and honest and direct is always the best way to go. Just lead with that. Say, I know I'm going to say the wrong thing or screw up, but I want to have these conversations. I want to be a part of the solution. And if you're upfront with it, people respect that, and it can start the conversation going. But always, whenever you have those conversations too, make it very clear that these are safe spaces. In that no judgment zones is what I mean, where understand that people are going to have potentially very opposing diametrical viewpoints, but we're all going to talk about it and move together, and there will be no judgment. Say what's on your mind, and we'll address it and move forward together.
I believe you were about to say diabolical there.
I had a Freudian slip. It's sort of
very good. Thank you, Paul. I have two more questions here, but a reminder to folks that are joining us, you can submit these via the Q&A at the bottom. Next question, how have you confronted employees about substance abuse? Any recommendations there?
I think luckily I've never had that sort of a situation. But in a past life, I had ran a drug and alcohol program, so I was trained on reasonable suspicion. From that standpoint, I would say the first thing is to lead with no judgment. Again, you're not judging the person, you're not judging their actions, you're not judging the behavior necessarily. You're approaching them on tangible fact. This is a fact. You smell like alcohol, or you smell like whatever's going on. Coincidentally or not coincidentally, I've noticed your performance has been going this way with that. We need to talk about it. Now, if you don't have a formal plan as much as that, that's one thing. But the conversation should still be had, because eventually, if they show up, if it gets too out of hand, then they start putting other people's lives in danger, not just themselves. So I think open, honest, and direct, and the no judgment zone is always the best way to approach those things.
Okay, and the final question that has been submitted says, given your background in DeKalb County, you are familiar with their demographics here locally. And you realize how hard it is to diversify. What are we missing? How can we be more diverse in a relatively homogeneous county?
Mm-hmm. Yeah, I think, I've heard, I don't think that's unique to DeKalb at all. I think even in big cities or big urban areas, people sometimes have a feeling of, oh, we just have a hard time diversifying, or we're not finding the right people. And I think that's a very limiting thought process, personally. I think that the people are there. The demographics are there. It's just going to them and finding them. And, it's as simple as, does the head of the local bank need to be a black man and you have to have him on your board? I don't think so. You can find anybody in the community. If you're a community nonprofit, who's to say that the local school teacher who is black, or the shop clerk, why can't they be on a board of directors, or a volunteer base? I think it's just finding the right people and forgetting maybe some of the titles at times that sometimes I think leads people into, they want someone of quote unquote importance to be on the board. I think all people have importance, and they have a perspective that they can lend. And in some instances, people that you're trying to serve could be on your board. Who's better to help lead you as an agency than the people that you're trying to serve? They have the perspective that the bank president wouldn't. I don't know if that necessarily answered or that particular one, but I understand the thought process, and I think thinking differently about it is the way to go. Meet people where they are, and they'll show you the way.
Very good. Any other comments or points you'd like to make, Paul?
I don't think so. I'm very open to connecting and continuing the conversation offline. I have my contact information up there for folks to reach out to me. I'm very active on LinkedIn and Twitter, and look forward to people reaching out and continuing the conversations if they want.
We appreciate that. And you have a great blog too. I mean, some of the work that you're doing is just really impressive. So we appreciate your time, Paul, and you've been such a great friend to DCMP. So thank you for that. We also want to thank everybody who joined us today. As I mentioned earlier, we're going to be sending an evaluation to you, and that email will also include this recording, and will include the PowerPoint presentation as well, because as you noticed, Paul curated quite a list of resources there that are linked out. So we'll provide that to you a little bit later on this week. We do encourage you to visit dcmp.org, follow us on Facebook. You can find our upcoming opportunities and trainings there. You can also sign up for our newsletter. We really are excited about our next upcoming webinar. You're not going to want to miss this one. It's on September 30th, and we're going to be welcoming Matt Gayer, who's the co-executive director of the Catalog for Philanthropy in Washington, D.C. And he's going to be presenting about fundraising events and year-end campaigns during COVID-19. You can find out a little bit more about that on our site, and you can register today. Once again, thank you for attending, and a big thank you once again to Paul LaLonde for sharing his time and expertise with all of this. Thank you, and take care. Have a good day.